The purpose of today, of course, is to update you on our daily tallies as well and give you the latest numbers. As you can see from this slide, a slide that's become familiar for those that have taken the time to watch these presentations, this slide represents the total number of tests and the positivity rate here in the state of California. Again, positivity rate is the number of people, the percentage of people that tested positive that were tested in the state. The first 14 days, and the two numbers you see on the slide, 40.8% and 5.1%, represent the first 14-day cohort of positivity. Again, most of the people in the beginning of this pandemic that went to seek testing were symptomatic, so it's not surprising those numbers in the beginning of this pandemic were so high. The blue bar you see represented on the slide are the total number of tests. So we have significantly increased the ramp of testing, and you've seen a significant decrease in the positivity rate. But I reminded you yesterday, I'll remind you again today, point of caution. The positivity rate has begun to increase over the course of the last few weeks. It's 5.1% now positivity rate over the last 14 days. What I'm not sharing in terms of a slide, but want to share with you in a transparent way, is a 5.6% positivity rate in the last 7 days. So this slide represents the last 14 days, but the positivity rate is north of the 5.1%, again, 5.6% in the last 7 days. Total number of cases, yesterday we had a record high, 7,149 people that tested positive for COVID-19. You'll see today that number dropped to 5,349, still higher than we would like it to be, still a point of concern. Yesterday, we tested a record number of people. Over 101,000 people were tested in the state of California. Now north of 3.7 million, roughly 3.7 million people have been tested since the beginning of this pandemic. We've averaged over the last 7 days 88,000 tests in the state of California. While that is significant, it's not where we need to be. We need to continue to increase our testing, continue to increase our community, what we refer to as surveillance, so we can get a better handle of the total number of positive cases and understand the nuances between those with symptoms, those that are asymptomatic without symptoms, and those that are pre-symptomatic. But these case numbers, when you get a look over the course of the last few weeks, we are seeing roughly 56,000 new cases just in the last 14 days, and so points of obvious and real concern. Accordingly, we mark, as we've made this point multiple occasions, consideration above all else to the total number of hospitalizations as it relates to people that are coming into our hospitals that test positive for COVID-19. Yesterday, I shared a slide with you that showed 29% increase in hospitalizations over a 14-day period. You could see from this slide, it's increased slightly to 32% increase in total hospitalizations over the last 14 days. We now have 4,240 individuals that are hospitalized as COVID-19 patients. Yesterday we shared, and I'll share it again today, a pie chart of the total surge capacity within our hospital system. This is an incredibly important chart, and this marks the efforts that we have advanced over the course of the last number of months, not just, again, to sit on our hands, but to address your anxiety and the legitimate concern we had to prepare for an increase in total hospitalizations. As you can see from this chart, some 52,745 surge beds have been identified that we can make available to meet the needs if capacity within our existing hospital system becomes stretched with COVID-19 patients. Like yesterday, today, roughly 8% of that capacity has now been absorbed. 8% of that capacity in terms of total hospitalization system capacity within our surge plan has been absorbed based upon the total number of positive patients in our hospitals. By the way, that hospitalization number represents a 3.5% increase compared to our previous reporting period yesterday. We look at ICU numbers, and indeed ICU numbers, not dissimilar to yesterday, are increasing. You'll see a 19% increase in this chart of ICU admissions over the last 14-day period. Yesterday it was 18%. So we're seeing a slight increase, 3% increase over yesterday, but over a 14-day period represents a 19% increase, 1,306 individuals within our total population of patients in our ICUs. This, represented on this pie chart, is roughly 34% of the available ICU beds within our system. If you compare this chart to the one I put out yesterday, we were roughly 29% or so of our capacity, or rather, excuse me, 31% of our capacity, forgive me, roughly in the ballpark, a few percentage points higher today in terms of that blue part of this pie in terms of the total capacity for two reasons. One, the increase in the number of ICU patients, but also a decrease in the total number, the universe of available ICU beds. Remember, that number changes day to day based upon the entire hospital system and the availability of ICUs for patients that come into the ICUs for multiple different reasons. Again, 8% on the hospitalizations of capacity, about 34% as it relates to ICU capacity in the aggregate for the state of California. And I'll remind you, as I always do, we do not live in the aggregate. And so these conditions are different, these percentages are different by county. And we encourage you, and I'll say this on multiple occasions in the presentation today, encourage you to go to the covid19.ca.gov website, covid19.ca.gov website, to take a look county by county at what is available, looking at those attestation plans, which are the preparedness plans put up by your county health officials in concurrence with your county representatives that attest to certain criteria and conditions before they can move further into the reopening of their economy, into these phases as they've been referred to. So that's an update in terms of the daily totals. I want to, though, go back and take advantage a little bit of your time today and talk about modeling. It can be a head scratcher, to be candid, going back months, watching all of these charts on the evening news and cable networks, people debating the methodology of these different models, people using the University of Washington models, maybe those using Johns Hopkins models, California using the UCLA models, or the MIT models, or the RAND models, or I can continue down this path. Many different models are put up, charts and graphs, waves, dots, and if you're like me, they can become profoundly confusing. And so today, I want to simplify what often you are presented, what you may look at and have your eyes roll, try to make some sense of it, and also to provide a framework in a moment where more people can participate in the modeling and avail themselves of their expertise to the collective effort here in the state of California, and we would argue across the rest of the nation, in improving our modeling capacity, making it more real-time, making it, more important than anything else, relevant in your lives. But the purpose of this model is to make 2 points. One is these models guide actions. They're not determinative of our future. You've heard me on multiple occasions make this point. The future is not just something to experience. We are not victims of fate. We can manifest the future. It's not something in front of us, it's something inside of us. I say this often. It's decisions, not conditions, that determine our fate and future. In the state of California, we are proof of that. You see this, one of the original models that was put out many, many months ago, very simple model that talked about no intervention, meaning you just rolled out of bed. We all just went along with whatever was thrown at us. And without any intervention, the expectation and the reality, as you've experienced in some states, that there would be a large surge or a significant increase in the surge of transmissions of the virus, and as a consequence, a big impact on the hospital care delivery system, on the healthcare delivery system. Interventions, what we refer to in technical terms as non-pharmaceutical interventions like stay-at-home orders, practicing social distancing, physical distancing, wearing a face mask, allowed us to prepare, protect, and promote, as we put on this slide, a different outcome. And as a consequence, because of the interventions here in the state of California, we were able to mitigate that curve, and we never experienced that sharp increase. But what we did do is we pushed out, because of these innovations, the growth of that curve, but more modestly, so that we had time to develop more capacity in our hospital system, more capacity to provide the protective gear that has become so important in terms of reopening our economy, and moreover, making sure that when people are in need of support and help, that we are there to provide it in a proactive, comprehensive, and thoughtful way. What we are doing today is not only trying to explain a little bit more about the modeling. Dr. Ghaly is going to come up here in a moment to do just that. But we want to open up the opportunity for more and more people to get engaged in helping us build our models, what we refer to in this slide as a model of models. You'll see that we currently have on our covid19.ca.gov website, and I encourage you to take a look at this site. And you'll see specifically, if you want to just go directly to the slide that I'm referring, go to CalCat, C-A-L-C-A-T, covid19.ca.gov. But this CalCat allows you the tool to get access to our models, these nowcast models, these forecast models, and then these larger models that run, frankly, just scenarios of planning. Dr. Ghaly is going to come up in a moment and explain a little bit of what forecast versus nowcast modeling means and how we've stacked all of these different models that I referenced just a moment ago together, and we've made them available on this site. But what we want to do today is something much more robust and significant, and that is we want to open up our site to netizens, as it's often referred to, of citizen scientists, people that are out there doing coding every single day. We want to give them access through an open source platform to all of the available data that we have, that I have, that our health professionals have, in a way that we don't believe has been done anywhere else in the United States. This is a deep dive for transparency and openness. This is a new resource that we're making available today. This open source resource is available at github.com/gov. You'll see at State of California, you'll see it on the screen there. We're making available the capacity for people to participate and help build our modeling capacity. Because one thing we recognize is the limitlessness of the capacity of expertise and talent that resides throughout the state of California, throughout the United States, and for that matter, throughout the rest of the world. The information that we're now making available is exactly the information we make available to county health officials. It's the information that guides the incredible work that Mike Wilkenine and DJ Patel have been doing on our team, these data expertise, the data expertise that they provide, second to none. It's the kind of work that they do every single day, where now we're opening up to all of you. We're opening up to mathematicians. We're opening up to people that are experts in AI, and opening up to our researchers and our scientists and our Nobel laureates and our partners across the spectrum, including, again, citizens that just have an expertise that hasn't been tapped, they haven't been asked, or they haven't availed themselves to the opportunity to engage. This goes beyond flat files, goes beyond, forgive me, APIs and these simple protocols. We're doing something much more dynamic, something much more interactive, something that could truly bring to life a visualization of this data in a much more timely way. It's rather simple. We want to make the modeling more purposeful. We want to make it more efficacious. We want to make it more meaningful. We want it to promote a different outcome by promoting a different consciousness and ultimately promoting a different behavior. And, dare I say this, we want to back up the health professionals, because this is the data they use that guide their decision making. And often that decision making is questioned by pundits, some for good reasons, some for more mischievous reasons, more of an ideological argument or frame. We want to put all this out there, and we want it tested, and we want it challenged. And we recognize there's a reason this is not always done is it will be tested and it will be challenged. And I think you deserve that. And I think we have a responsibility to advance that paradigm, that value, and that protocol. It's all about collaboration. It's all about engaging expertise. And as I say, many, many occasions, expertise can be found anywhere and everywhere, given the opportunity. And I think we've now afforded that opportunity. I think we're going to see some really dynamic and exciting things come from these new protocols and this new opportunity to engage in these new tools and ultimately help us engage in making protocols and process that help inform our guidelines and protocols and procedures, but more importantly, to encourage better individual behavior to back up the assertions that many are making about the critical nature of wearing face masks and continuing the social distancing and physical distancing required at this moment. Let me no longer belabor this. Let me now ask Dr. Ghaly to come up and make a little bit more sense of what these models may do, what they mean for you, for our decision making, and again, how all of you can participate now in helping us inform our next steps in this pandemic. Dr. Ghaly?
Thank you, Governor. Good afternoon. I want to take a few minutes to talk about the three different functionalities or real benefits of the CalCat tool that we're announcing today. Real opportunity to get information that I've been using here with our team in California for months to guide some of the decisions at the state level. The exciting opportunity today is to not just have statewide information, but as we've built our understanding of the different models that you heard the governor mention from across the nation, to be able to use those at a much more local county level. We know that county health officers and health directors are using this information on a regular basis, not to sort of support their opinions, but to really guide their decisions that are driving some of our actions as it relates to our response to COVID-19. So I just want to walk through three slides. The first one is really an understanding of what do we mean by nowcasting, what actually goes into a nowcast. It's very much like when my kids wake up in the morning and say, what's today's weather like? And I say, look out the back window and understand what's going on. Is it sunny? Is it cloudy? And it helps us understand what is going on today at this moment. It's really built around this concept of the R effective, or that notion of rate of spread. We've talked to you before, the governor mentioned just last week, this idea of R effective, this notion that one infected person, if the R effective is one, that person is going to infect one other person. If that R effective goes up to 2, it is one person infecting 2 people. And what we really want to see is an R effective that comes down below 1. And each bit above 1, so 1.1, 1.2, ends up growing our cases in quite dramatic levels. And that's when you see often those graphs or models that show the high, steep, almost hockey stick-like arc up. That is what we want to really work hard to avoid. And having this information, not just at the California statewide level, but to put it in the hands of people at the county level, allow this information to go into making decisions at that local level. The slide you see in front of you takes into account a number of different models that we've been looking at the state level. This is not California's own model, but that dark blue line that you see is actually the average of all of the other models that many of us are seeing in the news and in the press, and that we take our cues from. We believe that each of those models has strengths, and we wanted to put together a tool so that you can see the average, and those numbers get in the hands of local health officers and decision makers to guide future decisions. The next slide I wanted to go over is the forecast. This is very much sort of sticking with the weather analogy. This is like your 10-day forecast. This takes your current information, your current choices, and helps guide where you might be in the next few weeks. These are exactly the tools we see. They're built around that are effective for your communities, for your county, for the state, that help guide the decisions that we might make around how to emphasize and reinforce many of the things the governor has been mentioning over the past many days, focused on wearing our face covering, remaining physically distanced, washing our hands, staying home when you're sick, and protecting the most vulnerable. Again, we have on our calcat.covid19.ca.gov have a tool that brings together many of the various models, allows us to look at various different outcomes of the decisions that we're making today. The third slide is really highlights one of the key benefits of the tool, which is allowing us to look at various scenarios. The governor highlighted that today's decisions help us understand a few weeks from now through our models where we might end up. This tool allows us to take our current data, whether that's our hospitalization data, our case numbers, understanding some of those non-pharmaceutical interventions that we have in place, like wearing your face covering, staying physically distanced, and where we will end up in the next few weeks and months based on those decisions. And so it allows us to model exactly how we need to design activities and choices for today to help us plan for the future. And between these various tools, we believe inviting a number of new individuals to play with the tools, make them better, challenge them, as the governor said, that we will, as we increase our progress in our fight against COVID-19, have improved tools and make even better decisions in the future based on our work together. And I just want to reiterate that these are exactly the tools that empower your local health officers and local health decision makers to prepare better for what we're going to see in the weeks and months to come, and keep us as low risk and safe as possible in California as we continue to march forward in our fight against COVID-19. And with that, I'll turn it back to you, Governor.
Thanks, Dr. Ghaly. So, look, bottom line is we want to really empower individuals. We want to empower you. We want to empower others that are willing to contribute code, time, attention. We're now making all this data easily accessible in a machine-readable manner, something folks understand, many others may be curious about. But the bottom line is we are making this a seamless process of engagement, two-way engagement that we think will really advance the cause of understanding our capacity to deliver in real time our promotion to keep people safe and healthy in the state of California. Real progress has been made over the course last number of months putting this together, this platform together. That's why today we're releasing it. We're also putting out a series of other points of data. I have every morning, I reference this often, a dashboard that I receive with a lot of the information that we're providing here today and in previous days. We are now making all of that available as well, trying to, again, be as transparent as possible. Again, encouraging all of us with the knowledge that we possess currently and the knowledge and insight that we hope will be advanced through these efforts to make better decisions that ultimately can help us navigate and allow us to move forward in a much safer and more responsible way through this pandemic. In the spirit of safer and more responsible, let me take on a few questions in anticipation before they're asked. You may have seen some information came out, or rather the report that came out that Disney has not now decided to move forward next month, opening up their theme park. I want to just compliment Disney and their team for making that determination. It was referenced in their press release. The state of California had paused on providing guidelines in that space. That is an example of the data informing decision-making. And that is exactly what we'll be doing as we move forward and we look at conditions as they change in real time. Based upon the data, based upon local conditions, we'll continue to engage in those counties that are having more challenge or trouble than other counties. Again, about 11 counties that we're monitoring through this technical assistance programs, supporting those that are advancing into phase 3 in a responsible and thoughtful way, encouraging that, again, based upon the guidelines that we put out to safely reopen. I can't say this enough. When the state of California puts out guidelines, it does not mean go. The guidelines are a document of how to safely and responsibly reopen the economy, not when. We empower local decision-making, as is the case in California, a nation state, as we often refer to it. State is population. It's larger than 21 states combined. We recognize that we have conditions that are very distinct in different parts of the state. And as a consequence, we want to empower local leadership to make informed decisions, but we also want that information to be made public. And I encourage you and others to go to that public platform, covid19.ca.gov, to check in, see how your county is doing against the attestations that were put forth by county health officials, health officers, in partnership with their hospital system, in partnership with their elected officials. We will continue, as we do on a daily basis, to monitor all 58 counties in the state of California to provide technical assistance in real time. And to the extent we're making progress, we'll continue to move forward, not backwards, in a thoughtful way. To the extent we do not see progress being made and we're not advancing the cause of public health and public safety, then we certainly reserve the right to put a pause in terms of advancing into the subsequent phase. And, of course, we reserve the right always with the dimmer switch that many of you who have watched these presentations are quite familiar with. We have the capacity and ability to toggle back in terms of the stay-at-home order and the guidance that we put out. So that's an update on where we are. I just want to again thank DJ and Mike for their incredible work and the team they put together. These are the folks that rarely get any recognition. In fact, not rarely, they never get recognition. These are the folks behind the scenes crunching all the data day in and day out. They're the ones that know most about what's coming next. And I just want to compliment them for really pushing us in this direction and wanting to empower you, not just the elected officials and health officials, but empower all of you in terms of unleashing your capacity to, in real time, help inform our efforts to advance the cause, again, of public health and public safety in this state. We hope others will consider doing something similar along these lines with this machine-readable data. And we look at this as a playground of sorts for those that love to code, playground for those that love to mix and match data. And again, the purpose is to make it all understandable to you at the end of the day and much easier to digest. That's the purpose of this slide that we have up, so you can simply download that information and guide your decision-making day in and day out. I cannot impress upon you more. The most important decision you can make is when you're out and about in the public. Please, we have a mandate in the state of California to wear a face covering. We encourage you to do that. And we believe that can have a profound impact on slowing the spread, protecting you, protecting others, and sending a message of the seriousness of this virus. We encourage you, as always, to practice physical distancing. If you're going to enter into a crowd, please wear a mask. But first and foremost, we ask you, why are you entering a crowd? And we encourage you, if you do, to do your best to physically distance from strangers and others that you haven't been mixing with in the past. As always, wash your hands, use common sense and hygiene. Answer the call. You'll see that on this list, because that call may be from a health professional, one of these cohorts of individuals that we have been training on our contact tracing platform that may be calling you, that will provide confidential conversation and information that you can provide in a confidential manner that will help us mitigate the spread. Talk about people you may have come into contact with. Contact tracing has been used for decades. It's tried and true. It mitigates the spread of disease, not just COVID-19, but of other disease. And we want to encourage people to take those calls if indeed they receive one of those calls. And as always, the most important call is call for clarity and conviction on this point. If you're a senior or you have an underlying medical condition, please, please do your best to stay at home and protect yourself. The most vulnerable remain our seniors in this pandemic and people with underlying conditions. We can never say that enough. And of course, I wanted to reinforce that here on this slide as we need to remind everybody the power and potency of our individual decision making. It is not just government that will determine that fate. Again, it is individuals, the sum total of individual acts in the aggregate that will slow this spread, will mitigate the transmission of this disease, and ultimately allow us to move forward in a much more responsible way, ultimately to get to that place we all look forward to, and that is with immunization and with COVID-19 in the history books.